I'm Dr. Stuart Quan. I am currently a senior sleep physician at Brigham and Women's Hospital and Harvard Medical School, as well as working at the University of Arizona College of Medicine. So I graduated from medical school in 1974, subsequently did an internship in internal medicine at the University of Wisconsin. And at that time, critical care was kind of in vogue, and I decided to do a critical care fellowship back at University of California at San Francisco. And then I figured that in those days, critical care was basically run by anesthesiologists and surgeons, and my fellowship was with an anesthesia department, and I figured that who knows where the field was going, and I needed to kind of ensure my future by doing a pulmonary fellowship. So I went to the University of Arizona and started a pulmonary fellowship. And through serendipity, it just happened that one person who was interested in critical care at the university decided to leave and go to Brown. And so after a year of my fellowship, instead of doing 2 years, my chief, who was then Dr. Benjamin Burrows, and for those who don't know who he was highly invested in chronic obstructive lung disease, was very well known in the field. And his shtick, or what he was known for ultimately, I think, was determining the long-term natural history of COPD, and was the person who invented the term blue bloater, pink puffer. So he called me into his office and said, Dr. Hassan, who was leaving, is going to Brown, and we need somebody to be our ICU person. And you've already done a critical care fellowship, so I think the boards will accept that in pulmonary, and you don't have to do the extra year of training. And so if you would take a faculty position, do 3 months of attending in pulmonary, and by the way, you can be director of the intensive care unit and respiratory therapy. And also, by the way, it turns out that we're trying to start a sleep lab here. And I think that intensive care unit training and sleep lab stuff go together. And so why don't you do that too? Just to show you how sleep medicine was thought of in those days, he linked it to ICU. And so that's how I actually got into sleep medicine. Well, it turned out that we didn't have anybody who knew what they were doing after he gave me that job to run a sleep lab. And there were a couple of us. One person was a psychologist, Dr. Larry Butler, and the other person was a neurologist, Dr. Colin Bamford. And we kind of had a little team that we kind of tried to learn from each other to start this sleep lab. And as a consequence, I actually then went to one of the first meetings, sleep meetings, and it was a very interesting affair because in comparison to what we have today, you would be just shocked. I remember basically going to Anaheim, and we were in a hotel kind of next to Disneyland. I think it was a Sheraton, but it's hard to know. And I remember having a meeting. There were a couple hundred people there, and we would meet during the day, and there were also meetings at night. And I remember people getting up and talking about nocturnal penile tumescence and saying, what's going on here? I mean, people like Ishmael Karashan, talking about nocturnal penile tumescence. And subsequently, I went to another meeting and met Bill Dement, and he said, well, you really need to get certified. We have a test now. And so that led to taking the boards, and which was, I thought, one of the hardest things I ever did, considering that most of it was EEG and things I had no idea what was going on with. And then I became involved in basically the ASDC, as it was called, Association of Sleep Disorder Centers. And from there, I got into accreditation. So my first accreditation site visit was to San Francisco with John Sasson and Sarah Moscow. And I remember him telling me that the best part of this, since we weren't being paid to do this, was the fact that we got together in the evening, and we had dinner at a Cambodian restaurant. And then, of course, we went to the sleep lab. I forget which one it was. And at that time, the visit consisted of talking to the people there, of course, and then watching a technician hook a patient up to make sure they were doing it correctly. And then you went home about 8 or 9 o'clock or later, and then you came back the next morning, and then you talked to a bunch of other people and reviewed the record with them to make sure that they actually had a decent recording and such. And so I got basically into the accreditation committee, eventually became its chair. And from there, I went on to be on the board and subsequently became president in 2000 to 2001 or 1999 to 2000. I can't remember what, but certainly things have changed in the realm of accreditation. We still have an accreditation committee, but things are done differently now. The accreditation visits went from being these 2-day affairs with 2 people to just a daytime affair with 1 person to, I'm not sure what they do now, but it's certainly a lot different. So when I was president, the biggest thing, there were lots of things going on, but the big event that I think people will remember is that, as you know, the organization started out as the Association of Sleep Disorder Centers. And so it was an association of centers, not people. And then it was decided that there needed to be an individual membership. And so that started the Clinical Sleep Society. And then that morphed up into a bigger organization where the members actually became more of the centerpiece rather than the centers, although the centers had a lot of say because they supplied a lot of revenue to the organization. And it became the American Sleep Disorders Association. So when I became president, it was the American Sleep Disorders Association. And at that time, Jerry Barrett, who was one of the first executive directors of the association, he told us on the board that that wasn't a very good name. Nobody thought of associations as basically professional societies. And so that's when we became the American Academy of Sleep Medicine during my tenure as president. Now my time, it wasn't just, so I was president for a year, but I was on the board for several years before and after, and there were a lot of things that happened during that period of time. So we were a new specialty that no one recognized, basically. Despite the fact that everybody knows we sleep a third of our lives, nobody thought that we were much of a medical specialty. And so we were clamoring for recognition. And around that time, we finally got the AMA to recognize us, and we had enough members so that we became a member of the AMA subspecialty group. We had representatives there. And then we also, so we were trying to become a specialty just like every other specialty, and there were barriers to that. And one of the things that at Mark's specialties is that you have training and board exams and stuff like that. And that was a huge hurdle because organized medicine didn't want any more specialties in reality, even. And so when we approached, at that time, we had an exam too, which is a slightly different story, which we can get into, but it wasn't recognized as one of the official, American Board of Medical Specialties exam. It was, quote, a rogue board. And so we approached the various other, quote, legitimate boards and to have recognition. And they basically said, go away. And so we were getting nowhere with them. And yet at the same time, places like Mayo Clinic and others were having fellowship training in sleep medicine. So it turned out that we approached the AASM, which governed all postgraduate medical education in the United States. And we convinced Marvin Dunn, who was then one of the leaders of the AASM. I forget what his official title, but he went to kind of visit the Mayo Clinic and was impressed by the training and the rigor of the knowledge that was being imparted and such. And he basically then allowed us to apply for subspecialty training in sleep medicine. And that basically was the thing that tipped it over, so that the American Board of Medical Specialties decided that, hey, we need to recognize them with an examination. And that's actually how it happened. It was through the AASM recognizing us as a legitimate specialty for training purposes, and then the board said, we can't have these people out there having training without an exam, and so that's how it came about. Well, the academy basically was the driver of this. I actually recall basically being in Florida. I think it was Naples, Florida. And we had to write an application to the AASM. And we actually, part of our board meeting was spent writing this application to the AASM. So it was the board who drove this entire process. And quite frankly, we were the first of these kind of multi-specialty specialties where people came in from a variety of disciplines to enter into a new field. And after that, I mean, basically there were several others that actually came after us, and we were actually the pathfinders for this. So when people came in from various disciplines, they had their preconceived notions about what sleep medicine was. Plus, they had, in most cases, they had a limited perspective and limited experience in treating the array of sleep medicine. So one of the big challenges in the field was to recognize or to accept the fact that we were a discipline that encompasses the broad array of the various disorders that are related to sleep, and not be singularly focused, and I'll say predominantly, on the treatment of sleep apnea, diagnosis and treatment of sleep apnea. Because that was the thing that got people's attention the most, even though, for example, insomnia is probably the most prevalent sleep disorder around, right? And so that was a big challenge to accept, especially because there was this basically challenge or competition with the pulmonologists, of which I freely admit that I was one, to say that there really isn't a specialty in sleep medicine. Basically, it's pulmonary medicine and obstructive sleep apnea, and it's psychiatry, and it's insomnia, and restless legs and neurology, or whatever types of things like that. And it was so when you had people coming into sleep medicine, they came in with that preset of what their experience and what they believed the field should be, and then to get them to expand, to gain experience and realize there were other things besides their own particular limited condition that was relevant to their specialty. So that was that, and that still is an issue. And I think in part it's being addressed now by the fact that we have fellowships, which basically, because of the requirement in the requirements for the fellowship training, the fellows need to be experienced in a broad array of different conditions, so that they realize there's something other than what they what their preconceived notion of and their experience has been before. What challenges were when I was on the board? Well, I think that, like I say, the biggest challenges were the fact that we were basically in competition with these other specialties who didn't want sleep medicine to kind of come up in the field. The other challenges relate to the practice of sleep medicine. As most people in the field know, that originally sleep medicine kind of evolved through the performance of polysomnography. And so that actually, for a practitioner, generated the most money and was kind of the thing that actually made other specialties not want to actually have sleep medicine as a separate entity, because that was revenue that went to departments in academic centers, hospitals and non-academic centers and academic centers. And so a lot of it, there was that. And so there was the challenge to keep the revenue stream up in polysomnography, yet at the same time, home sleep testing was coming in. And so there were the innovators who were trying to produce different types of home sleep testing equipment. And there was the challenge that some people would say that they could do diagnosis of sleep medicine without sleep labs. And so there was that, and it continues to be that type of debate and change in the way people practice. And so even back then in the early 2000s, there was this question of what would the practice of sleep medicine be? Was it going to be this procedure-based thing, which seemed to be becoming passé because of technological advances, or was it going to be a specialty where it was focused on practitioners and how they treated patients? How did JCSM come about, the journal? Well, I think you have to actually go back a bit to recall that the AASM isn't the only professional sleep society. And even as it developed, even before the Association of Sleep Disorders became into existence, there was the Sleep Research Society. And so there has always been this competition or distrust, I would say, between the two societies, where the SRS was primarily a research-based organization. They focused on trying to develop sleep research and develop sleep researchers, and their whole focus was on getting more research money into sleep medicine, developing, supporting trainees into the field and such. And they basically, number one, they didn't like the fact that there was now this clinical society, and in whom their focus was on, they felt was on actually accruing money for their practices and stuff like that. So they actually resented that, I think. And they felt that they would be swallowed up by them, because there were many more sleep medicine practitioners than members of the SRS, and there still are. And so there were many attempts, there were a couple attempts actually to merge the societies, which you probably can talk to a couple other people and get more insight into that, which failed. And so we have these two societies, but the SRS published, well, actually the two societies agreed to publish the journal Sleep, but it started out as an SRS publication. But the membership of the AASM felt that basically they couldn't publish anything in the journal because it was all focused on basic sleep research. And so clinical papers could never be published because they would just get rejected. And in those days, there weren't a lot of places where you could publish clinical sleep stuff, because there was only the journal Sleep, basically, and I believe the journal Sleep Research, which obviously was research. And in addition, that were sleep focused. Now you might get something published in a pulmonary journal if you talk about sleep apnea and such, and so the AASM decided that we needed a journal that would be devoted to the needs of the membership of the AASM, which was primarily clinicians, and that we would publish our practice parameter papers there. We would encourage people to publish clinical types of research, and that, and so basically that's the way the journal started, and it was basically John Shepard who basically championed that. And so we actually had spent about half a day trying to decide about this and then decide on the name. And so basically there were various names for the journal that were bandied about. For example, one was the Annals of the American Academy of Sleep Medicine, for example, was one name, as I recall. And Archives of Sleep Medicine. And there were various names. And finally I think it was John's, instigation that it had to be the Journal of Clinical Sleep Medicine. And that's how actually the name came about. And I'm not sure why they selected me as the editor, but I'm happy that they did. And off we went. I asked Dan Bisey to be the chief deputy editor, and starting a new journal is pretty interesting because you have to decide on things like what the color of the cover would be, and how you want to have the references displayed in the papers, and how you gonna number every manuscript that comes in. There's little arcane little decisions that have to be done. And so you may recall that the journal was black. I mean, the cover was black, and that was Dan's idea. He wanted it. He thought that would make it distinctive. So that's why the original color was black. So one of the problems in starting a new journal, of course, is that it was easy to tell the membership we had a new journal, but there was hesitancy to submit because the journal was not indexed. And that is the primary obstacle. And so you'd have to go around asking people to submit papers, realizing that, hey, you'll get indexed when it gets accepted to be in the index, and you have to take it on faith that eventually we'll get indexed. And so it was always a little difficult to get people initially to submit papers. And the first two papers, in the first issue, David White had a paper looking at how many sleep labs there were in the United States. And that was like one of the first papers that got in. And then we decided to, since in our original ACGME application, we had to kind of detail out how the field evolved. And so that actually got written up as one of the first historical accounts of the field, and that was published in the journal as well. Now, the other thing that happened during my tenure on the journal is that around that time it became less common to have advertisements in the journal because journal advertising was going away because of changes in the various federal laws about what was considered advertising and that sort of stuff. And so the journal was never meant to be a moneymaker. It was basically a service to the membership, and it was distributed free to the members. But eventually it was decided that we had to go to basically an electronic only format, which I kind of resisted for a long time, but eventually, it is what it is. The economics of it are the way it is, and so it became electronically published, and that was a big change that occurred when I was the editor as well. Like I say, the journal never, to my knowledge, ever turned a profit. It's not like the New England Journal of Medicine, which for the Massachusetts Medical Society, what is a moneymaker. The journal doesn't really make money. It costs money to employ the people who do the production and stuff like that. And we did not charge to submit, unlike today. I don't think that for a lot of journals, you have to, sometimes for journals, you either have to pay to submit, or you pay, like open access journals now, you pay to publish, or even both. So we didn't do any of that initially, and so basically there was no income to support the journal except the dues of the members and how much the society, the AASM, decided they wanted the journal. The person who got me involved was Bill Dement. I went to he went around the country having kind of these little regional meetings to play up the field, and I went to one of them, and that's where he said, well, you guys have this little sleep lab. What you have to do is you have to get board certified people and be involved, and that's so he stimulated me to be involved in the academy. And then the other person that actually got me involved in the academy was Wolfgang Schmidt-Navarra. I got elected to the board. I got put on the board because I was the accreditation chair, and I forget why I got into accreditation, but eventually I became the chair. And so he pulls me aside one day in New Orleans and says, I want to propose you to be the next president. I said, what? I just got on the board. And he said, well, I think that you would be a good president. I said, I kind of demurred. I said, I don't think so. But then at the next board meeting, he proposes me and I'm the next president-elect. So that's actually how that came to pass. And so I have to thank him for his foresight in deciding that I would be a good president for the AASM. I'm happy he did so, because it basically spurred my rise in the organization and enhanced my academic career. And I can say that by being president of the AASM, it gave me prominence in the field. It allowed me to, from on the academic side to, as some people know, that I became the chair of the steering committee for the Sleep Art Health Study. The University of Arizona, where I was at the time, became a site for that study, which was the first multi-center study sponsored by the NIH in the field of sleep medicine. And in addition, basically, it led to me doing other things for the field. I became put on the residency review committee for internal medicine as a result, and I became on the new examination committee after American Board of Medical Specialties set up an exam. They needed to appoint an exam committee, and I got appointed and eventually became the chair of that committee. So that helped me a lot become, to do the things I did in the field. So other people that influenced me in the field, I think that there are a lot of people who were kind of never rose to great prominence, but I remember Richard Ferber, for example. Richard was, he and I had an interesting um, initial experience, we were both basically on the Part 2 examination scoring group for the old exam. And so for people who don't know this, that the original certification exam for sleep medicine basically was a 2-part exam. The first part was a multiple choice exam, which was actually quite hard. And if you passed that, then you got eligible to take the second part, which initially was you had 2 paper polysomnogram records to review, plus scoring a couple MSLTs. And so people would take that, and then they would write out their answers. It was, handwritten answers, and you can imagine, and they had to be scored. And there were 2 people who scored them, and on the committee, there was a group of people, and 2 people each scored every record, and you had to agree on, this, and he and I would have disagreements about whether somebody had the right answer or not, and read this record appropriately. And so we subsequently became good friends, and the whole experience of being on the scoring committee for that examination was a great example of camaraderie. And I might say that I will always cherish the times I've spent being on these scoring committees and board exams and that sort of thing. The camaraderie you develop with other people on these various groups is basically, it was great, and I've forged lifelong relationships with many of these individuals who I probably would have never met. And so, there were people like Richard Ferber and currently, I have to say, like Chuck Seisler. Chuck, he's not a clinician and was never into the American Academy too much, but he basically formed or helped me in the latter part of my career here, in that I had decided to retire from the University of Arizona, where I had been chief of the Division of Pulmonary and Critical Care Medicine and ran the sleep lab. But he found out that I was retiring and recruited me to the division at Harvard and the Brigham, and where I became interested in public outreach and education, as well as continuing my research in epidemiology and clinical trials. So I have a shout out to him as well. AASM is a professional medical society devoted to enhancing the practice of sleep medicine and educating the public on the importance of getting good sleep. I can tell you interesting things about the Part 2 examination committee, which I thought is pretty interesting. Little anecdotes. So I already mentioned about Richard Ferber and us scoring how the examination was scored, but the way the Part 2 examination was put together was basically 4 people. After I got on the committee, it was Wolfgang Schmidt-Navarra, Paul Gwynn, Richard Rosenberg, and myself. We call ourselves the Gang of 4. And so some months before the Part 2 examination committee, we would get together usually at the site of one of us, like it would be Albuquerque one year, and it was in Michigan another year where Paul was. And we would have to look at various records that were available at that person's site to figure out what would be on the examination, pick out a couple interesting records that would have things on there that people could recognize and write about and that sort of stuff. And so we would do that. And then afterwards, the records, people don't realize that we had to reproduce like 30 or 40 sets of these things. And so that's where Helmut Schmidt came around, because he had one of these recorders that could just continuously produce one after another. So they could be ganged together, so you could do 4 at a time and print out 4 paper records at a time so that you would get 100 or however many we needed, you know. And so people didn't realize that's actually how that actually was done, which is, of course, became passé once you could put this stuff on computer and people could read, off the screen. Which, after several years, that kind of became in vogue, and you could go to a testing center and do that. The other thing was that the Part 2 examination, before it became the American Board of Sleep Medicine, was always held in Columbus, Ohio. That's where Dr. Helmut Schmidt was. And he ran the examination, for basically, he started it and basically ran it until it became the American Board of Sleep Medicine. And this Part 2 examination was in Columbus, Ohio. And it was always interesting because it was held at this, I forget what it was, the Hyatt or I forget. But anyway, they would have other events there. And I remember once they had a Star Trek convention, there, and they would have dance recitals there. And so there were all this commotion going on, and these poor people are trying to take the exam, and there's a convention going on. And so that was always pretty interesting.